one thing I did want to share with you, because I don't want to dominate the time up here, but we do have a lot of time. As we thought we only had an hour, but it turns out we got an hour and a half, or an hour and 20 minutes in Harold's case. But I wanted to share with you some study findings on a project that I was involved in when I was at the National Indian Health Board. And this was this evaluation looking at self-governance programs. And I apologize for the resolution here because I put this together very quickly. But what I did, and this study is kind of being circulated, or will be later, to each of your tables. I didn't make enough copies. I expected about 100 folks here, and obviously, as I can see, there are many more than 100 people here. So we're going to get samples for you to share at your table, and we'll get this posted to the website so that you can download it. And if you send me an email later on or see me, I'm happy to email the report to you. But what we did, this report was a very comprehensive look at self-determination, self-governance. And what we looked at was in 1993, our base year, we looked at programs that were contracting, that had continued to contract in 1997, so over the course of 5 years, that were direct service, that had migrated to become a contracting program. We also looked at tribes that were contracting, migrated to become a compacting program, and what were the results from this process. And what we found in almost every case is that when a tribe was direct service and had gone to contracting, things had improved dramatically for them. For those tribes that were contracting and grew into the compacting, the self-governance program, similarly, things improved for them. For those tribes that were direct service programs that continued to be direct service programs, the picture wasn't so good for them. Things did not change as the previous two examples I've just explained. So these are net gains by programs, by type of service. So services that tribes added, the blue bar is IHS direct service, and the white bar are tribally operated programs. So these are the collection of self-governance and self-determination programs. And you can see that in terms of their community-based programs, tribally operated programs grew and expanded programs. For clinical services, you can see again there that tribally managed programs grew their services. Prevention. Tribally operated programs added more prevention programs than those that continued to be direct service. And I think this continues to be the trend today if we were to go out and do this study again. In terms of those tribes that added new programs, and I think this is just embedded in the previous slide, again, the direct service tribes are the 52%. Only 52% of the direct service tribes added new programs over this 5-year period. Contracting tribes, 74% of them added new programs or services. And again, self-governance tribes, almost 80% of them added new programs and services. Another important aspect that we looked at were those tribes that reduced services. So, over the 5-year term of this study, when you look at the compacting tribes, the self-governance tribes, 15% of the tribes that participated in this study reduced services. But when you look at the direct service programs, those programs operated by the federal government, almost 36% of those programs eliminated some programs of some type in their program. So I think the underscoring fact is that self-determination and self-governance works in terms of growing programs and that type of stuff. These are the service categories of programs that were added by the type of tribe. So it just shows eye, ear, nose, throat, mental health services, dental health, prevention, etc. Net gains in facilities by self-governance or tribally operated programs. So those tribes that were direct service, that stayed direct service 5 years later, only 5% of them added new programs, built new facilities. When you look at the tribes that went self-determination, self-governance, 44% of them developed new facilities. And these are the facilities growth by different, it breaks it down further, the tribally operated by compacting and contracting. Quality care indicators, very important element in terms of kind of the impetus for tribes to take over management of their programs. We asked tribal leaders how much, in the 5-year period, have things improved? And in almost every instance, the improvement in the tribally operated programs was significantly higher than direct service programs. This is a health director survey of the same. So in almost every instance, if you look at the differences here, you can see that they're starking, that the health directors feel that things have improved significantly higher than those that retain or continue to be direct service programs. Waiting times at health facilities also improved. So, but I think the point of that is that, you know, self-determination, self-governance, from my perspective, at least in my opinion, has significantly been a marked improvement in the delivery of healthcare services for our Indian people in our country. So I'm going to stop there. We'll take questions at the end, and I'm going to turn it over to Jeff Strommer, or Harold, if you need to. Okay, so I guess we're going to turn over to Jeff Strommer with Hobbs, Strauss, Dean, and Walker. Thank you, folks.
Good morning, everyone. Thanks, Jim. That was a terrific presentation. First, let me say that I'm really honored and humbled to have been invited to speak here. I know this is Musqueam. I learned yesterday this is Musqueam territory, so I'm delighted to be here for the second time. I was here last summer on a personal trip, and I want to thank the organizers and the Coast Salish people for giving me the opportunity to share with you some of what I'm going to share this morning. Let me start by giving you just a little bit of personal background. For the past 20 years, I've worked with Hobbs, Strauss, Dean, Walker, which is a national law firm in the United States that works only with Indian tribes and tribal organizations throughout the United States. I'm based in Portland, Oregon. The vast majority of my work is in the self-determination, self-governance field. I work with tribes throughout the country, from the Seminole Tribe of Florida down in the southeast up to the St. Regis Mohawk, where you're from, up in the northeast, as well as Alaska and Oregon and Washington and California and Arizona, basically throughout the United States. And over the years, I've had the opportunity and the privilege, really, of working with tribal leaders as they have implemented this vision that we're talking about this morning. And it's been a terrific ride so far, and I expect it to be a very interesting ride over the upcoming years as they continue. But enough about myself. Let me talk about what I was asked to focus on in my comments, which is to provide you with some background on the Indian Self-Determination and Education Assistance Act. Yesterday, I heard comments about a legislative framework that you all are talking about and considering. I'm also going to provide you with some of the key features of the Act so that you can perhaps use them as some ideas as you move into your legislative framework process if you decide to go in that direction. And hopefully some of the ideas that I'll share today and some of the ideas that have proven to work well in the United States will prove to be ideas that you will think have merit and you'll want to work into your legislative framework as well. I like to talk about the Indian Self-Determination Act because it really is one of the most extraordinary successes when you're talking about Indian policy in the United States. But the thing that is important, I think, to start off the conversation is for you to understand that this is a very new policy in terms of the history of federal-tribal relationships in the United States. The Act itself was passed in 1975. As recently as the 1930s and 50s, the policy of the United States, the official policy of the United States, was the allotment termination policy. The termination policy, as the term would indicate, was the policy of terminating the unique federal-tribal relationship. In other words, extinguishing the relationship. And over the period of the termination policy era, close to 100 tribes were terminated in the United States through legislation. Their lands were distributed out, and the special relationship between the federal government and those tribes ended. So, as recently as the 1950s, so 65 years ago, the policy of the United States was termination. Now, in the 60s, the United States, like many other countries in the Western world, went through a significant political evolution. The war in Vietnam, tribal leaders became much more politicized and political, and things started to change. And surprisingly, for those of you who think of President Nixon as a warmongering president, or perhaps not a very good president in U.S. history, he was the one in the United States who was the standard bearer of self-determination. In 1970, he officially ended the termination era in a speech and ask Congress to consider enacting legislation that he termed self-determination legislation. So he's the first person really at that level to start advocating at the national level for the self-determination policy. In 1975, following his speech, Congress finally enacted the Indian Self-Determination and Education Assistance Act. The Act today has 5 major titles. It's a very complex piece of legislation. The titles allow tribes, in simple terms, to step into the shoes of the federal agencies that up until that point had provided services to Indian people, assume the funds and the responsibilities that those agencies use to provide those services, and provide the services directly. Initially, there were capacity problems. Tribes were not used to running their programs. Federal representatives and officials were at the local level providing education, health care, and the whole range of services that the federal government provided to Indian people. So in the early stages of the development of the Self-Determination Act as it was implemented, a lot of time was spent on capacity building at the tribal level. Tribes didn't have simple management systems, didn't have financial management systems, didn't have policies in place, didn't really know how to put policies in place. So for the first 10 to 15 years, a lot of focus and attention was on capacity building at the tribal level. Now, in the early days of the implementation of the statute, I think it's fair to say that the federal officials primarily responsible for implementing the statute, they were in the Bureau of Indian Affairs and the Indian Health Service, were reluctant partners at best in this endeavor. Most of them came out of the paternalistic view of the termination era, and they felt they could do it better. And they were suspicious of tribes taking over these responsibilities. And at first, didn't want to give many of those responsibilities or funds over. So over a period of years, after a lot of push-pull, as I like to think of it, activities, political and legal, finally, the legislation was amended a number of times to change how the legislation worked and change the leverage and the power shift in the relationship to give tribes more power under the statute to force the agencies to actually implement it the way Congress had envisioned it when it was enacted. By the 1980s, many tribes throughout the country, not all, but many tribes, had begun, to some degree, exercising their rights under the Indian Self-Determination Act and had entered into the contracts that Jim referred to earlier, taking over, in some cases, very small programs, in other cases, virtually all of the programs that either the Indian Health Service or the Bureau of Indian Affairs carried out for Indian people. But the problems with the implementation of the statute persisted throughout the 80s. And towards the end of the 80s, a group of tribal leaders, Ron was one of them, decided that they wanted to change the paradigm. They were tired of having to constantly fight with the Indian Health Service and the Bureau of Indian Affairs to get them to implement the statute. And I won't go into the details of those fights, but they are mind-numbing, and they were painful, I can tell you that. So they decided to approach Congress with a new concept, the self-governance concept. And the idea was very simple. You give us all the money that these agencies use to provide services. We'll take over all the responsibility. You retain the trust responsibility, which is fundamental. We don't change tribal sovereignty in the process. And you get these federal officials out of our hair to the maximum extent possible. Very simple, right? Congress agreed, thought it was a good idea, enacted a statute which became Title III of the Indian Self-Determination Act, a demonstration project. The demonstration project started with the Bureau of Indian Affairs, and within a few years, it became evident that the concept could work. Not without some teeth pulling, but it could work, and it did work. And in the early 90s, the demonstration project was expanded to the Indian Health Service. And it also proved to be successful within the Indian Health Service. In 1994, the record of success was so clear that tribes convinced Congress to make permanent the self-governance program within the Department of the Interior. In 2000, the record of success in the demonstration project on the health side had proven so successful that they convinced Congress to enact Title V of the Indian Self-Determination Act. Now, that gives you a little bit of background about where these statutory provisions came from. Now let me focus, and I'm not going to get into the weeds because sometimes I think the weeds are boring to people, but I'm going to talk about principles in terms of what I think are some of the key principles that are in the self-governance programs, which have resulted in the success of the program. The first one I mentioned a few minutes ago. The self-governance program legislation does not change the fundamental trust responsibility between the United States and tribes. Okay? Everybody recognizes that the United States does not provide tribes with enough money to fully satisfy and carry out their trust responsibility to provide health care, education, and all of the other services that under treaties and other legal obligations the United States has towards tribes. So nothing in the statute affects that underlying trust responsibility. Nothing in the statute also affects a tribe's sovereign immunity. All right? So the fundamental principles that serve as the base building blocks of the relationship are unaffected. Another important feature is that participation by tribes is purely voluntary. There are a number of tribes that participate in self-governance today, but there are also a number that don't, and they do it by choice. They look at their relationship with the United States in a different way. That's their choice. So it is purely voluntary. The fundamental approach, I think, that has really succeeded in changing the dynamics so that we are where we are today is that the statute has provided tribes with legal tools to force federal agencies to enter into these agreements. So let me tell you how that works. It's fairly simple. A tribe sits down across from an Indian Health Service negotiator and tells the Indian Health Service negotiator, under the statute, you have a duty to tell me what programs you carry out for my people and how much you're spending to carry those programs out. Once that information is available, the tribe decides, okay, we're going to take over the dentistry program, we're going to take over the behavioral health program, but we're going to leave behind with you the information technology program, the whatever other program, the alcohol program. It's a menu of choices, in other words, that tribes can exercise. The first step, though, is the agency has to be completely transparent and tell tribes what is available. Once tribes decide what they want to take over, they tell the agency, they submit a proposal. If the agency decides not to transfer the program and the funds, there's a process called the final best offer. The tribe puts its final best offer on the table. If the agency doesn't agree to it, it can only reject it based on some very limited grounds that are built into the statute. If the agency ultimately does decide to reject it, there are appeal mechanisms built into the statute that allow the tribe to challenge the agency. Okay? So that framework has changed the balance of power because the agencies are required by the statute, unless some very limited circumstances are present, to transfer virtually all of the functions that they carry out. That's been exercised in various ways around the country. One of the next features that I'm going to talk about that I think is very important is the flexibility that self-governance gives tribes. One of the cornerstone principles is that tribes should have the ability, once they take over a variety of programs, to redesign them at the local level based on local needs. Tribal leaders are the closest to the people who are being served. That's a very simple concept. They're answerable to those people. If they don't satisfy the needs of the people they serve, obviously they won't get elected. That's not true of federal officials who provide the services. They answer to somebody else. So they are less tuned into the needs of the people that are receiving the services. So the authority to redesign a program, the authority to move money around from one program to the next are cornerstone aspects of the flexibility. One other aspect of the flexibility is that tribes can do it however they think it best works with other tribes. You heard yesterday from Lanny and Andy, Jimmy, up in Alaska. Alaska's model is completely unique. There is one agreement. That's it. 220 tribes sign on to one agreement with the Indian Health Service. And they have essentially taken over the entire Indian Health Service delivery system in Alaska. If you go to rural Alaska and you run into a medical problem, you're going to go to the Indian healthcare system. And it is completely run by tribes, 100% of the system. I like to think of the Indian Health Service crew that still is in Anchorage as a skeleton crew. That's really what they are. They have the authority to sign the agreement that transfers the dollars, and they have enough staff to be able to account for the money and monitor some aspects of the agreement. But other than that, the entire state is under the control of tribal leaders and tribal policymakers. At the other end of the spectrum, you have areas like Oregon, Washington, California, where tribes in Oregon and Washington, for example, some tribes are direct service tribes. They basically leave the bulk of their services with the Indian Health Service, while other tribes are self-governance tribes. So you have a mixture of tribes and agendas of tribes that are playing out. It's the flexibility that the statute affords to come in, out of the program, to combine with other tribes if you choose to do that. There are a number of examples around the country where some tribes have come together in consortiums to better maximize their ability to provide services in certain geographic areas. So there are all kinds of combinations. The only limits to the flexibility is that you can't do anything that's illegal. That's it. Otherwise, the creativity of your imagination and how the services can best be delivered are the limits. So it's a very flexible system that works well. Another important aspect, and I mentioned this before, is that under self-governance, there's very limited federal oversight. In fact, under Title V, there's no statutory provision that actually requires tribes to provide reports. It's that limited on the reporting end. But tribes have come to the realization that without providing good data, the agency itself is unable to make appropriation requests that really meet the needs. So instead of the federal agencies trying to impose their will on tribes by requiring that certain reports be written, which was the old system, under the new system, there's a very collaborative relationship where the agency works with tribal representatives to create reporting requirements and data sets that are the least burdensome for the tribes, but that provide the kind of information that the agency needs. So it's a very collaborative relationship rather than a one-sided relationship where federal officials dictate what needs to be done by when, and if you don't provide it, we're going to cause some problems for your program. Finally, one other feature of the self-governance program that I think is very important is that it allows tribes to step into the shoes of the federal agencies from whom they take over programs. What does that mean? Well, it literally means they take over the program responsibilities and the funds. I've already said that. But it also means other things. Federal employees, when they're carrying out responsibilities on behalf of the federal government, are covered by an insurance in the United States that's provided through a statute called the Federal Tort Claims Act. So if a doctor that's hired by the Indian Health Service commits malpractice and is sued, the Department of Justice will defend the doctor, and if any damages are awarded, the Department of Justice and the government pays the damages, okay? In the private sector, private industry, private doctors have to have their own liability coverage. It's a very expensive thing to have. So tribes who carry out healthcare services step into the shoes of the federal government with respect to Federal Tort Claims Act coverage. They benefit from that coverage to the same extent as federal employees. A couple of other examples. Tribes have the ability to be treated like other federal agencies with respect to federally owned property disposal processes. What does that mean? Well, the Department of the Army, for example, sometimes goes through a review of all the property that it owns, real property, equipment, cars, boats, and they decide that they have an excess amount of property for their mission. They make that property available to other federal agencies. So the Department of Health and Human Services, Department of Agriculture, all of them have the ability to try to access that property. If no other federal agency wants it, then it typically will go up on an auction, in an auction process for private individuals to purchase it. Tribes have the ability to step into the shoes of other federal agencies to access federal excess surplus property. And many tribes have used that ability to grow and expand kind of the capital resources that they use to provide services. Another example is one that was just built into the Indian Healthcare Improvement Act, which is a part of the Obama healthcare reform legislation. It's a provision that allows tribes to access the federal employee health benefit plan. One of the dirty secrets in the United States in the whole healthcare debate is the fact that federal employees have one of the best health insurance programs in the country. Congressional representatives in the House and Senate have one of the best health care programs, but yet they find it difficult to make sure that the average American has a good health program. It's a dirty secret, but it's one that is useful, at least in this instance, for tribes, because now they have the ability to access for their employees the same federal health employee insurance program that federal employees benefit from. So that's just to give you an example of a few ways in which tribes are able essentially to step into the shoes of federal officials. In most instances, what that allows tribes to do is provide the services more economically than if they were to do it purely in the private sector, and it's of great assistance to the programs on balance. I think I'm probably using up my time rapidly here, so let me just conclude with a few comments. I started off by saying that I think this policy has been one of the most successful. I think that that's an accurate comment. There's a study, I think, Jim, I'm not sure if you made copies available, there's a Harvard project that has been studying tribal governments in a variety of ways for the past 15, 20 years. And they have studied the effectiveness of the self-determination policy. And the study conclusively, I think, demonstrates that it really is an extraordinarily successful policy that has helped tribes build their capacities, that has lifted tribes in not just ways in which tribes provide services that previously were being provided by federal officials. The ramifications of the policy application at the tribal level is much broader than that. The latest study that just came out ties economic development activity, successful economic development activity, directly to the capacity building that happened as a result of the implementation of the self-determination policy. So the improvements to the health in the context of health have been dramatic. There's still a lot of improvements that have yet to be made. As Jim pointed out, one of the biggest challenges is funding. It's a terribly underfunded system, and that's one of the biggest challenges. But in terms of the ability to use the money that is available, it clearly is the best system, in the United States at least, and has proven to have the best results. But the other benefits really are enormous and have proven to be, I think, to be really the cornerstone in terms of the success of this policy has been, if you look around Indian country and you see those tribes that are the most successful, most of them are heavily involved in self-governance, not just providing those services directly, But Ron's tribe is an example. The Jamestown Scholar tribe has so much going on in so many directions that sometimes it turns my head when I hear them talk about everything that they're doing. And I think a lot of that traces back to the capacity and the ability that they have gained through the self-governance program to operate just the basic functions initially and then build off that and use that as a platform. So I will cut my comments short here and turn it over to Ron, and I'll be available for questions as well. Thank you very much for your attention.
Well, thank you, Jeff, and Jim, for that opening backdrop. As you all know, my name is Ron Allen. I am the chair for the Jamestown Scholar tribe, located across the strait from Victoria. So we're a Coast Salish tribe, and so we have a lot in common with many of our British Columbia brothers and sisters. And I spend many a time up here in dealing with fishery issues. I'm a U.S. commissioner representing the 24 tribes on the state side with regard to fishery issues. So I'm up here regularly and go up deep into the British Columbia territories and the bands, with regard to the fishery issues. So I'm always, it's an honor here. I join Jeff in saying thank you to the Musqueam people and the Coast Salish people for inviting us here and the organizers of this event. I too am honored to be able to share with you my thoughts and experiences that we have had in the South with regard to the healthcare agenda. I also want to pause and say, Harold Harbaugh, he mentioned that he and I were joining forces way back in the 80s. And back then, he had much longer hair, and I had hair. But it was a pleasure. He was a fabulous chief for the St. Regis Mohawks and a great representative for their people. And I'm always delighted to see him. I see his name regularly throughout First Nations activities because of his leadership and the skills that he's been blessed with. We're here, and you're here, to talk about something that is very important to your people, health. Now, as tribal leaders, we have to ask ourselves, what's the most important thing in our communities? Now, that's a tough question for a chief or a leader of your respective nation to answer. Is it self-reliance? Is it economic development? Is it creating jobs for your community and for your people? Is it stewardship for your natural resources that the Great Spirit has blessed you with and put into your hands to provide oversight over it to assure that it will be protected for not just your current generation, but future generation? Is it education for our kids? So that they grow and they become more knowledgeable, and as we leaders pass on to them the responsibilities of our communities in all these areas that which we serve our people, is the education more important? Is protection of our culture, our traditional practices, our religions, our language, is that more important? How about public safety? How about our law enforcement, protecting domestic violence or violence against Native women and so forth that go on, and we're well aware of it, and we're appalled at those challenges that happen in our community? How about taking care of our elders that are always so culturally important to our communities that we may have not been able to do what we think we should be doing? Health is right there. And when I'm asked that question, throughout Indian country, when I go around in our arena or go into Washington, D.C., and I go to the White House, and the White House says, what's the top 3 issues that you have? Give me 3. I go, man, how am I going to answer that question? Because all those areas that are important to the welfare of our people in our community are equally important. But meanwhile, we have to do what we have to do to address those issues on each one of those fronts. Sometimes we refer to what we're doing as a war, and these are just many battle fronts that we're fighting to advance the interests and protect the issues of our communities. We do what we have to do, and we instruct the various resources and people we have to address those subject matters, to make sure that they're being addressed and taken care of to the best of our ability, to the best of the resources we have at hand. We must do that. So, as we talk about health care, and as you are entertaining here in the last couple of days and today and tomorrow, what are you going to do about health care here in British Columbia among the 200+ First Nations up here? And my message is going to be very simple. Unity is power. If you're not unified, you don't need an enemy. Look across the table. The issue is that I've experienced this experience throughout any country. I spent a lot of time dealing with a whole array of issues that we need in our communities: health and education and housing and jobs and so forth. And we're complex too in the U.S. We have different approaches, different styles, different strategies, different arguments, historical arguments, cultural arguments, moral arguments, legal arguments. We always have those arguments. But you have to start somewhere. Build a foundation. What we should have done is water under the bridge. But we are here where we are. You are here where you are today, and you have an opportunity in front of you to be able to put together an initiative that is going to benefit your communities, and as Jim was showing with the success that we've experienced, raise the capacity and the quality of health care for our people. I have no doubt. I've seen some of your materials that Joe and others have shared with me, in terms of where you feel you are and what your needs are, and you're going to always be struggling to get those needs higher and higher. But you can only accomplish that goal if you're unified and working together and being sensitive to all needs, whether they are indigenous peoples in urban communities like here in Vancouver, Richmond, or whether they're in the remote areas in northern British Columbia. They all have needs, and we have unique problems in terms of making sure that we're providing those services to those people. And at the end of the day, we need the resources to make that happen. We need more access. The amount of monies, the revenues you get from the federal government will never be enough. Don't ever think that you're ever going to get it. They're not going to pony it up. Canada is no different than the United States. Even though they know it and they will acknowledge it to your face, they're basically going to walk away and say, can't get there. So what are we going to do about it? And what we've done in the United States with regard to the self-governance movement is we are taking control of our destiny. We are sovereign people. The roots of your authority and your power is in your sovereignty. You're sovereign as a people. An old friend and mentor of mine, Joe Delacruz from the Quinault Indian Nation, who has spent many a time up here playing basketball and baseball, and I know he was a cheater, but nevertheless, he would come up here because he thought he could get away with it. But he used to say, if you're a sovereign and you're a government, act like it. Now, the non-Indian political sector does not want to accept that, and they will resist it. But you don't have to blink. You can stand firm and continue to work together, because if you come in and if you have a delegation of tribal leaders coming in and representing your interests, talking to the British Columbia province and the leadership, or in Ottawa with the federal leadership there, then you're carrying a lot of power. You're carrying a lot of power, and they're going to pay attention to you because it's politics. We are in a world where we are playing the non-native political system. It's reality. Deal with it. Deal with it together. We're respectful of our sovereignty. We're respectful of our status. So as we advance this agenda, and as you deliberate on what you're going to do, the perfect system doesn't exist. With Joe and your team here, with the health consortium, I can't figure the name of it, Joe, but anyhow, the consortium that you're proposing here, they're going to come up with a proposal, a plan, a strategy. It is a beginning. And it will be dynamic. It will continue to grow. It will continue to change. It will continue to be refined, in terms of how it will serve the respective nations and their communities and the uniquenesses of those communities and their needs. And you will continue to get stronger and serve better. And I can assure you from our experience, it will work, because we can do a better job than any federal system, any non-Indian system outside trying to serve our needs. Quite frankly, they're out there and they need us for their jobs. We have to, as we advance this agenda, and I encourage you, and unity is my biggest message here, but my other biggest message that goes with unity is trust. Trust. It doesn't matter how big the tribe is that the leader comes from. The Spirit blesses some of our leaders with talents and skills and capacities and ability to lead. Trust them. You have their back. Trust them. You delegate them, and then they will come back and report to you what they've been able to accomplish on our behalf, our collective behalf. I can tell you many a times when Jeff and I and others have worked in Washington, D.C. to advance and strengthen our legislative authorities and foundations, I find myself the only tribal leader among a whole lot of attorneys representing respective tribal communities advancing that agenda. But I'm a tribal leader, and I report back to them, and they have confidence in me. Once in a while, I'll get a few more tribal leaders. 565 nations in the United States, and 335 of them are in self-governance, more than half. When we started in the 80s, there was 10 of us, barely 10 of us. Now it's really clear. Take control. They also start seeing how much success that we're generating, as revealed by Jim's presentation, and it works. And it will continue to work, and it will continue to grow, and you'll continue to get better. You'll be able to recruit the kind of talent that you need to run your clinics, your hospitals, to run your administrative operations, to protect your interests. Trust them. Trust your leaders. Move forward together. If you have issues, vet them. Find common ground. Don't come into these forums with just the only way is my way. We can't do that. I'll wrap up here because one of the most dangerous things with a tribal leader is give them a mic, But we on the U.S. side, your brothers and sisters south, who know no border, we are here together. Okay, you have a different political system in Canada than we have in the U.S. So there'll be variances of what will work for you than from us. And all we're here to do is share with you our experiences, to share with you control of our destiny, exercising our sovereignty, advancing our health care, and all the other many issues that are relative to health in our communities is working. We got a long ways to go, but we're not going anywhere. Our people are growing in numbers, and we need to take care of them. We need to take care of those youth. We want to make sure that we leave a good foundation for our children's children. We want to do that. When we're done and we're in our rocking chairs, and looking back, we can say we did good. We did what we could do, and we did the best we could do. And unity is it. Trust is it. Leadership is it. Initiate it and move it forward, folks. I mean, I really encourage it. We're here to come back and share with you any of our thoughts and our experiences. Whatever is relevant is relevant for you, and you're the ones that will know what's the best way for you to advance your agenda. So I'm very honored to be here. Fight for your rights. Fight for your community needs. Thank you.